just actually going to introduce and welcome our online people at home tonight before we make a start here. We're still waiting for a few people to join us. Lovely to have you all here with us. But to all our online viewers, thank you so much for joining. It's absolutely a pleasure to have you here with us. Oh, we've got this camera working.
Yeah.
Hello. All right. Yeah, look, I think we're so lucky to have the available technology, and the beauty of having this run as a live webinar for people who are a long way from our local region just means that we can reach out and communicate with people no matter where they are. I think we've got someone from Goondiwindi tonight. We have two ladies here in our clinic tonight who are actually from Goondiwindi who've already had their surgery. I know we've got someone from Rockhampton, Mackay, and all over the place. So please stay with us. We'll be starting very shortly. Thank you. It won't be long. I know. Well, I mean, it seems to play it by ear as they come in. Yeah, we have to squeeze on them. David, is that
Little one isn't at the moment, but I'm working.
before?
That's what I do. I'll do this one.
Yeah.
Okay, so so maybe just send your Instagram I'll just wait for this lady to go downstairs and then we'll start.
Yeah, maybe just take one of the. Come on into the. Yeah, come down to the front. Woo-hoo. Yeah, actually. All right.
I'm going to take this one from the front.
Yeah, you can take that one. All right.
I think I'll make a start and let latecomers join us as they get here. Thank you so much for your patience and for waiting for us to make a start. And welcome to our February Information Night. My name's Felicity. I'm the CEO of Weight Loss Solutions Australia. You might have seen when you've been looking at attending tonight that we do like to have a little bit of a theme for our information evenings. Did anyone see that in some of our Facebook promotional stuff? So the theme for tonight was all about, you know, if you can't stick to your New Year's diet resolution, that you need to change your approach now. Anyone really think about that, you know, the New Year's all about making resolutions, trying another diet before they actually make a decision to move forward? Has anyone been there, done that? Anyone know what New Year's resolutions are like, that by the time you get to February, they tend to be already out the window? Been there, done that? With making those kind of setting goals, often that's what happens. And statistically, you know, so many people do set out with great intentions with the new year and set those New Year's resolutions that often by around about this time of year become a distant memory, and the reality of actually making that stick is so hard. And I think that's where, you know, making permanent change and lifestyle change, and where weight loss surgery is so effective, where, you know, diets and other things in the past might not have been successful for you, but we're looking for something that's going to mean that you're never going to have to think about diets ever again. So I think that's really important. One of the things I'd like you to do now, before we actually get going and before I actually give you a rundown on what tonight's going to look like, you've got a little notepad and pen. Has everyone got theirs out of their bag? I'd really love you to actually just take a moment, a little bit of reflection, and this is just for you. It's not something that we're going to ask you to hand back to us. And this is great for anybody in the room, even whether you're having surgery, not having surgery. Goals are an important thing to think about. So if there were 3 things that you could change about yourself between now and 12 months' time, what would that look like? And if it is relating to your weight loss journey, how do you see yourself 12 months from now? What are the 3 most critical things that you would love to change the most? And how does that look? It might be you're thinking about having a family, and, you know, fertility could be an issue, and endometriosis or whatever it might be that's impacting your life. Could be being able to actually tie your own shoelaces. It might be, I really need to deal with my diabetes. I want to get rid of sleep apnea. I want to get into an economy class aircraft seat and be able to put on the seatbelt without an extension belt. Whatever it is for you, it's your journey, and these are things that are relevant to you. And I think sometimes just putting that down on paper and taking the time to think about that, something that is actually fantastic to look back 12 months down the track and see how far you've come, because you will be amazed at what is actually really achievable with a permanent solution through weight loss bariatric surgery. So I'll leave you to keep going on that for a moment. All right, I'd like to introduce you to our team. And we have an amazing team of allied health professionals here to support you along your way. They're not all here yet, but I'll start with Natalie is our nurse. Tonight, she's actually going to give you an overview of all of the procedures and how they work, and answer your questions in relation to each of the bariatric procedures. Our dietitian, Erin, is going to give you a bit of a rundown on how diet applies to each and every procedure, and answer your questions as well. She's far from the food police. Don't be scared. You know, this is a really specific role that the dietitian plays in relation to education for patients entering into this kind of environment with bariatric surgery. Does anybody at this point in time have an idea about which procedure they're interested in? No? Show of hands, anyone know what they're interested in? Yep, got a bit of an idea. Those interested in sleeve, can I have a show of hands? Yep. Anyone interested in the gastric balloon? Not at the moment, maybe you'll change your minds. Anyone specifically interested in the gastric band? Not at the moment. So the sleeve is, and that's actually quite indicative of, where we're at this point in time in bariatric surgery. 16 years ago, when I first started in this business, the lap band was the only device that we had available to offer our patients. And it still has a place to play in a smaller, more niche environment in terms of patient selection criteria and what's going to suit each individual. We're really lucky now that we can actually really individualise a program and choose best procedure for each individual. The sleeve, has become a really dominant option and, procedure of choice for a number of reasons. And tonight, you're going to have the chance to hear from two amazing patients tell you their story about how they've achieved and what they've done and the whole journey for them with the sleeve gastrectomy. We do actually have our psychologist team member joining us shortly, but he's often running late, probably looking after picking up kids and waiting for his wife to do the swap, so he should be here shortly. On reception, Kelly is one of our administration team. You've probably spoken to her on the phone at some stage. A lot of Kelly's time is spent supporting patients access their superannuation for early release of funds from super, which is a common pathway for financial access to for those who don't have private health cover specifically, and sometimes for those who need help with the gap. So if you have any questions in relation to super, Kelly is the one to ask. Erin is our patient relationship officer, and probably a lot of you have spoken to her also. They're both able to help guide you on the, where you should be at any one time in the process along the way, especially in that first critical 12 months. Any questions about what tonight looks like for you? This is about you. I will absolutely encourage you to ask as many questions as you like, and for our online viewers as well, if you type in your questions, we will answer them for you as we go. Can I just also get anyone who's online just to actually let us know that you can hear me? If you can just type in "sounds okay," that would be great, just to let us know. And welcome, please ask away your questions, and we look forward to hoping that you will be leaving here tonight well equipped with all of the answers that you're looking for. I'll be back with you shortly. I'd like to hand over to Natalie to present to you the information regarding each of the procedures. Please make her welcome.
Hi everyone, like Felicity said, my name's Natalie. I'm the nurse here at Weight Loss Solutions. More often than not, I'm your first point of call. I'm the first person that you'll see, which works really well. It means that I have the time to explain the different types of procedures that we have here, but as a show of hands shows, most people more often than not actually have done so much research so that they already know what particular procedure they're after. Here at Weight Loss Solutions, we obviously are a 12-month program. However, one of the things that we look for is that we want to know that in 5, 10, 15, 20 years, you're still using this fabulous experience and education that we provide so that you're still on your weight loss journey or maintaining your fabulous goals that you've already achieved. One of the things that we really obviously are concerned with that's associated with obesity and weight gain are a lot of the comorbidities. So, sleep apnea, it's a huge one, okay? A lot of people have it. Some people don't even know they have it. Something as simple as waking up snorting in the middle of the night. Okay, and more often than not, it's actually maybe a partner or somebody in bed with you who actually tells you that you've got that issue. Things like Felicity mentioned, fertility can be really affected. Okay, that's one of a really big thing with younger families and younger ladies that actually has a big issue and impact on their lives. Things like high blood pressure, strokes, heart disease, these are all things that we can actually reduce the risk of or eliminate entirely. Excuse me. It's always get nervous the first time you stand up in front of a bunch of people, no matter how many times you do it. These are things that we can all eliminate, if not get rid of entirely. Okay, and that's what our goal is finding yourself again. We all know that we are all individuals. We're all having this wonderful, great thing called a life, and we want to enjoy it to the best of our ability. And sometimes that can be inhibited, whether it be because of medical issues or because of our weight. So weight is something that we can actually help you with. All right, so that's really a big thing that we love, and that's why we have such a great support team. So one of the things that we talk about when we talk about our programs here at Weight Loss Solutions, and all 3 of our weight loss techniques or weight loss things that we use, is we call them tools. And you'll find that all of us actually will refer to you, please use your tool, okay? So when we talk about using your tool, we're saying, okay, down the track, we're talking 5, 10, 15 years. We want to know that you're still using that whatever tool you've got, whether it be your sleeve gastrectomy, whether it be your band, or whether it be the fact that you've had a balloon in for 6 months and those techniques that you've learned in those 6 months, continue on, okay? So one of the things that we want to say to you is it is not an absolute miracle cure, all right? We never promote that, we never say that, but what we want you to know is that they do work as long as we use them really well. And this is why we do a full 12-month program here. This is why we say to you, we want you to learn, we want to educate you, and we want to help you through that first 12 months so that we know you've got the fantastic basis to keep going on and up, which is what we love, okay? And our lovely presenter speakers tonight are, you know, exhibits of learning great techniques and learning great education and moving on up. So I suppose what I often do is I go through the different procedures that we have here. With that, I'll also tell you about the minimum set that we love to see people as well. So when we say 12-month program, anytime you want to call us, give us an email or anything like that during that 12 months, we're open. But there's also a minimum set that we love to see you, okay? And that's so that we know that you're getting the best support that we can give you. So I've heard that most people are interested in the sleeve. Is that right? Yep, okay. So what I'll do is I'll leave that for last because usually that has the most questions associated. So what I'll do is I'll start with the balloon first. Has anyone heard of an Albira balloon before? Yeah, one person? 2, okay, great. So really with the balloons, what they are is they're something that's a fantastic non-surgical technique and tool, okay? So it's really great for those patients who might need to lose a smaller amount of weight, maybe a 10 or 15 kilos. Maybe they've had, they're due for orthopedic surgery. I've got one of my ladies who needs a knee replacement. They can't do it until she loses a little bit of weight because there's, you know, it puts a lot of extra pressure on her body. So therefore, she's going to use the balloon to help get rid of that weight and maintain her weight loss. What it does is it actually looks like this. It's made of silicone, and yes, before you all comment, I understand it looks like a breast implant. All right, that's my most common thing with everybody. And what it does is it actually gets, it's under a very light anesthetic. Has anyone heard of endoscopies or colonoscopies? Yeah, most people over 40 have, unfortunately. I'm so looking forward to that. What we do is we actually insert a camera down your throat, okay? And we have a look at the top of your stomach and make sure that everything is all okay. Then we put in a folded down version of this, all right? We then, as you can see, we then inflate it. If you can't see that, forgive me, it's a little bit caught behind there. And we usually put about between 400 and 700 mils, closer to the 700 mils in it. Okay. Now what it does, like with any of our tools, it restricts how much and controls our portion sizes, which is really great. Then with the balloon, what we then do is we actually inflate it with normal saline and we put something called methylene blue in. Has anyone heard of methylene blue? No? It's a special dye that they use in a lot of diagnostic procedures. So it's really safe, but does anyone have an idea as to why we might put it in?
In case it bursts.
Yeah, in case it leaks. That's exactly right. And do you know what sort of happens if it's blue? What might happen? We know it's leaking, we pee green.
Okay.
Blue and yellow make green. So you will pee fluorescent green, which is quite interesting and amusing. So that's one way that we know that there might be an issue with your balloon. Okay, so we fill that up and we leave that in situ. Now, for any of our procedures, you'll find that the lovely Erin, when she talks, she'll go through a 6-week post-operative diet phase with you, and we go through that with the balloon just like everything else, all right? You will find with the balloon that some of the common things that can happen with the balloon, nausea and vomiting are a side effect. The movement of the balloon is a side effect. It can actually go down a little bit lower, but being full of saline, and being malleable, you can actually move that yourself and you can move it back up into the right place, which is great. I know it does sound daunting, but it's actually really, really easy. The great thing about the balloon, it is a 6-month initial part of your program. We'll have the balloon in place for 6 months. And during that 6 months, we would love to see you every month or talk to you on the phone every month. And that's usually with Erin, our dietitian. She's very nosy, I'm warning you all now. She'll call you really frequently, which is really great for our patients. So, but she's very nosy. So what we do is we call you or talk to you once a month. And basically what we want you to be doing is learning how to eat your small meals really frequently during that initial 6 months. And the reason for that is because it is forced portion control. We can't fit much more in than that. So those fantastic, educated and great decisions that you're making in that habit that you're forming in that first 6 months, once we've taken the balloon out, we'll continue in that second 6 months. And that's what we're aiming for. And that's why we do the full 12-month program with this one. Okay, so it's a fantastic option for patients who might want to lose a little bit less weight than some others, who want a non-surgical alternative to weight loss, and who really want to be in control of their own weight loss. So that's really, really good. Any questions on the balloon? No? Okay, great. What I'll do is I'll pass it around so you can all have a look and have a feel and a squish. Now, admittedly, I know my balloon looks a lot less dense, and that's because over a long period of time, it's probably gotten a little bit, a little bit out every now and again, but that's quite old, that one. It's for sample, which is great. The second one I'll talk about this evening is the gastric band. Who's heard of a band? Yeah, okay. So like Felicity said, it's a really, really common procedure. It's something that's been around for a really, really long time. And for a long while there, it was actually our only bariatric surgery option. Now, obviously, it's fantastic that we've got all these options now, which is great. But the banding, there's so many good things about the band, and it just suits so many people over some of our other options. And this is where, we'll help you through your educated decision or your own research, and you'll reach the decision that you want to reach. But with the band, the great things about the band is it is a surgical procedure, okay? So it is a one-night stay in hospital overnight, and we do put you under a general anaesthetic, okay? It is done laparoscopically. Who knows what laparoscopic means? Yeah, keyhole surgery, okay. So, which means it's a lot less invasive than some of the other surgery where we might open you up, all right? With the lap band, and the great thing about the lap band is that you have full control over it. So this is actually also removable, all right? So it's a semi-permanent thing. So I've got patients of mine who have had theirs for 10, 15 years, so you can have it for as long as you want, okay? And that's the great thing about the band. So this is how the band works. As you can see here, Exhibit A. With this particular one here, what we do is we have the stomach, okay? On the initial, at the very, very top of the stomach, we put around the stomach this part here, all right? And that's the site that goes around the top. Can everyone see the little grooves we've got in here, the little plastic bit? That's where our saline gets put. Now, what we do with the band, the idea is that we attach it to the top of the stomach under a general anaesthetic. We then actually anchor it in place just with a little stitch here, okay, to make sure that there's no slippage. And then what we do is we actually want to increase over time the amount of fluid in this. I think the balloons are hit down the back. They're squishing it. This one here, we want to increase this slowly over time so that the top of the stomach becomes reduced in size. So basically you're forming I knew that would happen. There we go. Please stay, thank you. We form a little pocket up the top, and that basically forms our stomach. So that's where our food will go into and get slowly processed from. Okay, so you can see how that is portion control. You can see how that small pocket up the top will only allow you to eat that smaller meals and eat frequently, which is great because that's what we're after, okay? So with the band, once the band's inserted, we actually get you to do the post-operative diet, which Erin will talk about. And then from there, at about week 6, you come and see me. And this is where you and I become best mates, because this is where we try and adjust your band to suit you and to titrate that up to the best. And we want to get into what we call the green zone, which is a really great area where you're feeling that small, frequent meals are filling you up and you're staying full in between those meals. And that's really great, okay? So there's lots of different ways to do it. The port actually sits just below your skin, usually about here, and that sits up the top there. Okay, can everyone see that? I'll wiggle around. It's one of those things that we do need a little bit more toing and froing, just because we want to make sure that you get the best out of your band, and we want to make sure that you actually end up in that green zone, okay? So nice, and making sure that that actually sits nicely. So you can see on my stomach there, if everyone can see that for patients at home, it sits nicely around there and forms this little pocket up the top, okay? So look, some of the things that can or may happen with the band, sometimes we can cause a little, or there may be a little bit of slippage, okay? So the band itself might slip down a little bit lower. Now, you'll actually know about that because you'll feel a bit crook, you know, those sorts of things. You're not quite right. You might be drinking water and thinking that you're feeling a bit fuller a bit sooner, okay? And then what we do is you come in and see me, we take some fluid out, we send you away for a test or two, and we have a look and see if that's actually the reason, okay? So what else with this particular one? So the port is really great. because I can access this whenever, if, for example, you know, you've got full control over it. So if you know that you're going away on holidays and you know that sometimes planes can make you a little bit sensitive, you might be a little bit stressed out at work, there might be something going on, your band may get a little bit tighter. Because as we say here, a stomach is like a toddler. You poke it, it screams. So it's very reactive to hormones, very reactive to stress, that sort of thing. And that's the great thing about the band, is that we can actually titrate that to suit you and what's going on in your life at that point in time. So that's the great part about the band. Has anyone got any questions? Yeah.
When are the scenarios where you choose that option?
Yeah, sure. Look, it depends. If you want full control over your weight loss, if you don't want because when we talk about the sleeve, it is a permanent solution, lifelong and permanent. Okay. The band can be very, very permanent, and it has a really long life. But if you want that semi-permanency and something that you have more control over, then that's for you. Yeah. So there's lots of different choices with that. There's lots of different ideas. Everybody is different, and that's why that band may suit some people who want that full control better. Okay. There may be some other things, like, for example, if the sleeve is not an option because of BMI issues. So with the sleeve and with for example, the balloon, we have a lower BMI that we look at. Has everyone heard of BMIs and body mass indexes? So with the balloon, we have a bit of a lower BMI for the balloon for patients who undergo that. With the band, our patients from a BMI of 30 onwards would look at having a band. Whereas a sleeve, a patient from a BMI of 35 and upwards. Now, of course, that's all dependent on your weight right now, your highest adult weight as well. That's all taken into consideration in having a chat with our doctor. So that's another reason why the band may suit other people. Yeah. I had one of my ladies the other day whose band's only 5-6 months old, and I saw her this morning and she said to me, the reason I wanted this over the sleeve was because I like the idea of the fact that I have full control. So that really is important to a lot of people. Yeah. Any more questions? No? Okay, great. So on to the sleeve. Who's interested in the sleeve? Yeah, who's done research? Okay, great. So look, you two down the back. I'm probably going to tell you things that you've already heard or you've already looked up. So feel free to interrupt me anytime, and if there's anything you want to know at the time, please feel free to ask. So with the sleeve is a permanent surgical option. Okay, this will last your entire life. This will be with you forever. All right. So that's why we actually look at BMIs of 35 and above, because it is a permanent surgical solution. And that really suits some people, particularly patients who have had long weight loss histories, people who have tried everything, they've yo-yoed for so many years and nothing really seems to stick or work. All right, and this is really where Felicity was talking about your New Year's resolutions, how you want to try that one more thing. You guys have already obviously realised the fact that, you know, sometimes we all need help. Okay, and the gastric sleeve is a great way of help. Now, I want you guys to all understand this is not the easy way out, so don't ever let anyone ever tell you that, okay? It's still a tool and you still need to use it, all right? So what we do is we take out up to 80% of your stomach, okay? And it's gone. What we do is we have a beautiful long thin tube there now, and that's sealed off with titanium staples, some Teflon and some glue. The reason we seal it so well is because one of the major complications of a sleeve is a leak. Has anyone heard of a leak when they were doing their research? Yeah. Yeah, okay. They are nasty. We don't want one. Okay. So a lot of what we do, Dr. Adib himself has a less than 1% chance of a leak. I think it's about a 1% chance Australia-wide. What we want, and most of the things that we do in that first little while when it comes to this particular procedure, is making sure that we're keeping that stomach nice and still. And one of the reasons is we don't want to put any extra pressure or any undue stress on that stomach and increase any small risk we already had. Okay, so one of the things that Erin will go through with you is the 6-week post-op diet. Okay, in week 2, 3, and 4, you're on puree. So think the consistency of baby food, mashed potatoes, that sort of thing. I know it sounds very appealing, I know, but you might get to that phase and you'll say, Natalie, I just want to chew something. I haven't chewed anything in 2 weeks. I just want to chew something. Let me be the voice inside your head and don't do it. The reason for that is because we want to make sure that your stomach stays very still. And Erin will go through with you why we do that. But also when we do that, we actually have, all of this is smooth muscle, which basically means it's all involuntary. It will actually hit down the intestine and a small little wave will come back up and it will come up into the stomach. and it just might put that extra little bit of pressure on that stomach that we don't want. Okay, so when we say we've got the 6 week post-op diet, we want you to stick to it. So a lot of what we do in that first 6 weeks post-op is to really make sure that we keep that stomach beautiful and still, and then eventually moving into learning to digest again. Okay,
Does the risk of the leakage stop after your 6 weeks, or does it continue on the lifetime of?
Yeah. So the question for you at home was, does the risk of a leak increase, or does it go away after the first 6 weeks? And it actually does. So that first little while, those first 4 to 6 weeks, even the first 10 days are when we might have issues. Okay. After that, the body naturally takes over and it will start to seal itself like it does with anything. You know, you get a cut on your hand, cut on your arm, it starts to naturally form scar tissue and heals itself as well. And that's what the body does, and will actually naturally heal over that scar really well. Yeah. It is done laparoscopically, like the laparoscopic band, okay? And it's a 2-night stay in hospital in Wesley in Brisbane. Right. The 3 major pain complaints I get about this particular procedure. The first one is you have had major renovations. All right, we've had a lot going on in there, you will get some pain. But more often than not, most people are on Panadol by day 2, day 3, but you will get sent home on pain relief. Okay. The other one side effect that we can get is heartburn or reflux. Has anyone already got reflux here? Yeah, I get it, it's nasty, it's not fun. So one of the things we do is send you home on anti-reflux medication as well, okay? And we send you home on anti-nausea medication. So we're going to send you home on everything that you need to make sure that you're okay. All right. The second major pain complaint that I get about this particular procedure is to do with the laparoscopic part of it. Does anyone know why you might get shoulder tip pain after you've had laparoscopic surgery? No? Yeah, it's the gas. Yeah. When we do laparoscopic surgery, we actually blow up your belly with carbon dioxide just so we can have a look and so we can see. The body needs to reabsorb that. And one of the things that can happen is it can get caught in your shoulder. So it's a bit bizarre, but there's a few techniques that you can use. Things like heat and peppermint tea and moving really get rid of it, which is really great. So that's one of the things that I do here from patients. The third major pain complaint we get is because this is a beautiful thin tube now, we don't want it to flip on itself. So what we do is we actually anchor. So we use a dissolvable stitch and we anchor that back into the body so that it doesn't flip. So you might be out and about, you might reach down for your bag and you'll go, oh.
Text message.
That's fantastic. Oops, I love it. One of the things we may get is you'll feel that pain as you bend down. You actually get that stitch underneath your left-hand side of your rib, okay? So you'll bend down, you'll go, oh, okay, there's that pulling or there's that stitch that Natalie was telling me about, okay? I had one of my ladies say to me the other day, she's 6 weeks post-op and she said, you know what, I started back boxing. And I said, okay, that's great. She said, but I know I overdid it because all of a sudden I got this pain in underneath here. I said, yeah, you did overdo it a little bit. Just take it back a little bit and then go from there and just slowly work up to. So she must have been doing some really hard punches and really assaulting that punching bag. So, so you can get that little bit of pain and it will go away because it does dissolve, okay? When you go home from the hospital, you'll actually find you have 5 what we call port sites, which is the where we've actually stabbed you, okay? And you'll have some dressings on those. We usually just get you to take them off after about 7 days, and there's little paper stitches on underneath, and we just get you to leave those on until they fall off. So nothing else needs to be removed. There's no other sutures that need to be removed or anything like that, which is really good, okay? We often tell people, watch out for constipation or diarrhea. They can be issues, okay? If they are, we just need to deal with them with things like prune juice, pear juice, natural laxatives if we can, those sorts of things, okay? So that's something that we can get, and we do get people telling us or letting us know that that can be a side effect, but we know we can deal with it, which is great.
Long-term side effect?
No, it's not. The question was long-term side effect. It's not, no. No, it's just usually those initial phases where your body's just getting used to how much you're putting into it and your fluid. A lot of it's got to do with how much fluid you're drinking as well. Now, we want you to drink a lot of fluid, and Erin will talk to you about that in a minute. But sometimes when you're just not getting in as much as you used to, you may find that you get slightly constipated or something along those lines. And that's okay. We've got ideas and things to help you along with that, which is good. Yeah. What else do I usually tell people with the sleeve? The great thing is that the sleeve being a permanent option is that down the track, and why we do the 12-month program here is that, like I said, in 5, 10, 15 years, we want to know that you're still using your tool. We want to know that you're still using your sleeve effectively, you've reached your goal weight, and that you're maintaining. And that's we absolutely love to hear that. So, which is really, really exciting for us.
How would it not work? If it's permanent,
Yes.
how would 10, 15 years down the track
Yep. Okay.
they're not working?
Sure. You will never again have a full-size stomach. Okay. It won't grow out to that far ever again. But if you are not using your tool, if you are choosing every time you choose it to eat a meal, you're choosing wrong foods. Now, we all know what the right foods are. We've all done yo-yo dieting. We all know about the right foods, wrong foods. If you're choosing wrong foods every single time you go to eat, and you are overeating to the point of feeling so full, you feel like you're going to vomit every single time you eat, after a long period of time, you may find that you might be able to fit in a little bit more. Okay, so that's why we're talking about using your tool, and that's why we want to educate you on and with this, and you'll find that Erin will talk to you about this, is we want nutrient dense meals, because every mouthful counts. When you have a stomach this size, or a pocket this size, or this size above your balloon, every mouthful counts. So you want to get as much nutrition in your every teaspoon, and that's really, really important. So that may be where people can go awry. That's where people can go astray from that, is that they're just making really the wrong choices consistently and overfilling themselves. And that's why our full year program is all about education. I told you Erin's very nosy. She rings you very often. She's not the food police though. She just asks you how you're going, which is good. Any other questions? I'm just trying to think if there's anything else. Yes.
What are some long-term negative consequences? So like 5 years down the track, what are some possible negative consequences to only having such a small stomach?
Sure. I suppose one of the only things that down the track what we do is we aim for about 12 months, we aim for entree size. So I suppose one of the negative things is that you'll never be able to order off the main menu in a larger portion again. And mind you, in essence, really what you do is you get your larger portion, then you get your takeaway container, you cut it in half, put the takeaway container under the table, and you get to eat it twice. So always only ever being able to eat that small portion.
But what about your body? Is there any negative consequences?
You're losing weight. Yeah. You've reduced your risk of heart disease, you've reduced your risk of hypertension, you've reduced your risk of that sort of stuff. As long as you're eating your nutrient-dense meals, and again, this is why we talk to you about using your tool, you're fine. And this is why my patients can have them forever, and why the bands are 10, 15 years worth of, at the very least, yeah.
There's no future procedures that you might need that this would stop you from having?
Not that I know of. That's a good question. I haven't had that one before. Not that I know of. Yeah, because what we're doing is we're only taking out the stomach. So, for example, say if you needed to have some surgery internally, whether it be on your intestines or anything like that, absolutely not. It's no real difference to say having your gallbladder out, in that something's just not there. Okay, so it's not that would stop you from ever having, say if you needed to go in and have some surgery on your ladies cervix, uterus, anything like that, that would never stop anything like that. Yeah.
I know I've got heaps of questions.
No, please, feel free.
In the beginning, you said something about it taking up to 80%.
Yeah, it is 80%.
How do you determine, how much is taken?
Sure, the surgeon does, what he uses something called a bougie, or I think I pronounced that right, I can never get it right. They use them for all sorts of different things, and they have a size 8. And what he does is he actually puts that down into your stomach so that he knows he has the right size. So he does that for you. So that takes out that 80% of your stomach. Yeah.
And
which
so
is great.
there different sizes in that?
Not usually. He's very happy. When you compare Dr. Adib with some surgeons, you'll find that he's quite conservative. So he's conservative in that the 6-week post-op program that we do, or post-op diet that we do, might be a lot longer than some other surgeons. But again, we do that because we want to prevent any extra risk you have. Again, he might be more conservative in that he takes out that full 80% on most people, so that we have a great result, so that people can live with that result and get really great weight loss out of that. Yeah. What else?
No, I'm done.
Yeah? Oh, that was only one question. Sure.
Is there any history of body rejecting the materials that are used to seal it, so the titanium or Teflon or anything else that's used?
Yep. Not that I'm aware of. However, I'm not the surgeon. So not that I'm aware of. Now, look, there are everywhere. There are people who are allergic to different things, and you know, I know that there are some people. I'm a nurse. I'm a normal nurse. I go and work in a hospital as well, and I've only ever seen one patient that didn't like their knee replacement. I'm 15 years nursing now, and that's one person. So look, I'm not going to say no because I have never seen it, and we can definitely double check with Dr. Adib, but I've never heard of it. But there's always, you know, one or two people out there that may have really sensitive bodies. Yeah, so I'm not going to say no definitely, but not that I've seen or heard of. Yeah.
Is there any, sorry,
No, you're right. Go.
is there any pre-existing health problems that you might have that might keep you from having surgery?
Sure. So any pre-existing health problems that might keep you from having the surgery. One of the things that Dr. Adib likes to look at is his super obese patients and whether or not they can lose a little bit of weight prior to having this sleeve. But even then, when you get to a patient where it's actually getting to the point where it's this, or you know, the comorbidities are just building up and up and up, this is obviously the best alternative. So that's really an assessment that's made with the doctor. The only other thing that you'll have to talk to the doctor about is, has anyone ever heard of a fundoplication or hiatus hernia repair? No, it's where a hiatus hernia is where you have the top of your stomach that's been pushed up through your diaphragm. Okay, if ever there's been a repair of that, that would be a discussion with the doctor. Yeah, so those things would be discussed with the doctor, but they're flags for me. So when you come in and see me, I go through a bit of a profile and I say, okay, how's your history, those sorts of things, you know, what operations have you had, all those sorts of stuff. And that's when I would flag things for the doctor to discuss with you. Yeah. Did you have a question?
I did. With regard to the gastric balloon.
Yeah.
You mentioned that some side effects are nausea, vomiting.
Yes.
What sort of duration do you have those side effects for?
Sure. Look, with the balloon, nausea and vomiting is expected, and it's really, really common. And usually what we do is for the first at least 48 hours, we would expect that as part of that. Some people find that they're okay and they slowly recover after that. Again, everybody's so different. Some people find that they're okay after the first 24, and other people find that even 5 or 6 days later, they're still actually getting over that. And that's the other thing I forgot to mention, sorry, is that we actually give you some medications that you take home as well to prevent all of that from happening. So we've got anti-nausea medication, we've got anti-reflux medication, and we've got some anti-cramping medication as well.
Okay, so
Yeah.
essentially it's short term.
It is short term, yeah.
Also, whilst we're talking gastric balloon,
Sure.
what's the risk of that particular procedure?
Sure. So like with anything, any anaesthetic risk, but anybody who's had a colonoscopy or endoscopy can tell you the risk is really minimal and really low. But the things with the balloon are a possible leak and it moving. And they're the two main side effects or issues that we might have with it. And the risk for it being leaking or anything like that is really, really significantly low. And the balloon moving, sometimes it happens. And if it happens, then I can actually teach you to move it back. So that's really good. That's the advantage of that balloon. Yeah. If the lovely Felicity is looking at me very carefully.
I'm just wondering if we can save the rest of the questions
Yeah,
so that people
great.
can come and chat to you individually afterwards, if that's
Yeah.
all right.
I'm a big talker, can you tell? So thank you everyone. If you've got any questions, come and see me
Yeah.
afterwards.
Thanks so much, Natalie.
Thank you. All right. If I can just add, in all the times that we've been doing balloons, we've never had a leak, ever, never had a perforation. So as Natalie mentioned, there's the methylene blue is used to dye the saline in the device, so that if there was a leak, you'd know about it. But we have never ever had one, and we've done a lot of balloons since we first started. And you know, my take on, is there any risk down the track, five years down the track? If you're taking on board the education of the team and you're committed to working with the team, and we are very insistent and really kind of try to impress upon you that how important it is to connect with a team of people who are here to help you, because the education over that first 12 months is so critical. The surgery alone is not going to do the job for you. It's a tool, it's a day in surgery. The 12-month opportunity to work with the team, that's where you get results, and that's what's going to prevent you at 5 years down the track ever having any issues. So if there was to be pouch dilatation or expansion of your stomach at 5 years out, I would say it's because you have not absorbed, retained and practiced all of that really valuable education that you get from our team. And that's really critical to long-term results and why it's so important to us. This is we're not looking at quick fix procedures. This is a change for the rest of your life. It's to not only resolve medical conditions that might already start to be impacting your life now, but also preventing you from ever having to deal with medical complications down the track as a result of excess weight, which are far more threatening to you long-term forever than having surgery. We're very proud of our results, incredibly proud, to be honest. The complication factor is so low. I don't actually remember the last time we saw a complication, touch wood. But in saying that, the most important thing also is having a team of people who are going to manage it for you, making sure that there's going to be a positive end result. That's critical. And that's where this team is so effective in making sure that we're managing our patients well. I only see the benefits. I think with the sleeve gastrectomy, it's incredibly powerful as a tool and an opportunity to help people not just get permanent weight loss, but totally change quality of life and health outcomes for the rest of their lives. So that's what we get to share with patients every day. I would like to just comment just for a second on the band. I think I had a post on our Facebook page about a week ago that started to stimulate some quite active debate, and there's lots of negative conversation out there in the community about the band. And what I can tell you in a practice that's been running for 16 years is some patients do really well with bands, and some patients, for whatever reason, do not do well with bands, and the sleeve has actually taken over as the procedure of choice. But that doesn't mean to say that the band is not an effective option for some people. If you've got a BMI of 30, 31, for example, and you need to lose 20 kilos and there's just no other solution for you, then the band can be that, and you live locally, which is really important for us now, and that's where medical device technology has changed how we actually approach what's right for each individual. If you live in our local area and your BMI is, well under 35, for example, the band could still be the right solution for you. So I'd be very careful about looking at all that negative kind of conversation, and give yourself the chance to be evaluated, assessed, and talk to the team about what is right for you as an individual. And there's so many different factors that come into play. So we're a full service bariatric clinic. This is what we do every day, and it's not a place that is just one procedure for all people. That's what it was 16 years ago, and I think we're really lucky now that we've got so many other opportunities with the balloon. The balloon's brilliant, especially for people who really do commit to working with the team. So there are options. We've actually had clinical trials in this practice before. We're really keen to be part of the cutting edge of where bariatric future is going to be for now and the future for the long term. So something that we'll continue to do forever. All right. I'm going to come back and talk to you a little bit later about some other things. I'd just actually like to mention Eric, who's online from, how do I say the suburb? The location?
In Cobar, New South Wales.
Cobar in New South Wales, which I think is somewhere west of Dubbo. Is that right?
Yeah, pretty much.
Yeah. And the one thing I wanted to mention, not just to welcome you here, and we've got patients from all over Australia, potential, hopefully, patients we'll hope to look after. But we not only run webinars like tonight so that you can access the information as people who are here in the room, but we do a lot of consulting via Skype, email, phone. No one should ever be disconnected from our team, and that goes for sometimes for people who are actually quite local. If you're in Brisbane and can't get to an appointment, there's never an excuse not to be able to connect with our team. Phone, Skype, email. Skype I think is fantastic because it's almost like you're here. So we make the most of those kind of tools to help patients no matter where they are. All right, I'd now like to pass over to our dietitian, Erin, to tell you all about food. Please make her welcome.
Okay, hello everyone. It's really good to see so many people coming out tonight. That's actually really fantastic. And hello to everybody online as well. Thank you for logging in to our seminar tonight. So my name's Erin. I have been with this fabulous team here now since July last year. So I think we worked it out. That's nearly 7 or 8 months now. And I'm also a community oncology dietitian, and my background as a dietitian has mainly been in oncology. So one of the amazing things for me being a part of this team here and meeting so many people like yourselves and like our fantastic patients that we currently have on board is that I'm I'm seeing people every single day who are taking such positive steps in changing their lives for the better. And I think it's such a fantastic thing to be able to have that opportunity and for you all to be here tonight with that goal in mind of, you know, everybody who's walked through the door here tonight has the goal of making a positive difference in their lives. And I think that's wonderful. And I really think you should all be applauded for coming here tonight. I think that's great. So hopefully, having a listen to Natalie explain some of the procedures has answered a fair few of your questions that you might have had when you've been researching certain procedures online. Show of hands in the room, has anybody here ever been to see a dietitian before? Maybe it's in the hospital or in a clinic. I know Jay's just stuck his hand up the back there. Has anyone been to see a dietitian in attempts to lose weight before? Yep. Was it a good experience? It was all right. It was good. Okay, good. Yeah. Now, I guess, you know, a lot of people who come into our clinic, you know, looking into these various procedures, have done everything. And I think I learn new things just about every week from patients who've been on particular weight loss programs or diets or fads. I think I should actually start writing a book about the most ridiculous ones that I've ever heard of. But my point is that you've been so thorough in trying again different methods to lose weight, and not all of those experiences have been particularly positive. And sometimes that can include seeing a dietitian, because one of the things that I think a lot of people will say to me when they first come in is that, well, I saw a dietitian, she told me to do this, this and this, and it was too hard, and I didn't feel it was tailored to me, and I didn't really feel very engaged with the whole process. And usually that's when they sort of give up on that and the cycle starts again. So I'm not like that. I'm pretty good. But basically, a bariatric dietitian is going to be very different from dietetics experiences that you've probably had in the past, because what we're really working towards in our clinic here is we want to step away from that diet mentality and there being rules and restrictions, and I can have and I can't have, and I have to do this and I can't do this. Our main aim, and we actually had a talk about this as a team today, our aim here is that we want to bring balance and positivity back in to your eating. We want joy to be the main thing that comes from your eating and comes from your food preparation. So improving your relationship, not only with food, but with yourselves and how you relate to food, is definitely 100% what I want somebody to achieve during our time that we spend together. So what I might do first, and please yell out questions as you do have them, and that goes for everybody online as well. If you have a question, please just type it in and stop me. Now, I think we had a show of hands for the gastric balloon as to who was interested, and I think the main group of people here tonight are actually interested in the sleeve more so. But I do just want to touch on the balloon for our people online, and also because I really love this program. I really, really like this program. So as Natalie has explained, what this program entails is that we do have the intragastric balloon that sits in the upper part of the stomach. Now, in terms of dietetics and our eating, what we need to do, and what we'll discuss when you do come and see me about this, is what we need to do to prepare your stomach to have that balloon inserted, so that we can minimize any of that cramping, that nausea, and some of those side effects that will occur within that first 48 hours. And then also what we want to do while that balloon is in there for that 6 months is we want to train the stomach to manipulate foods and fluids around that balloon, so that once we can get comfortable with that, we can work on feeling comfortable with a smaller portion size. So what you're looking at in terms of preparation for the Orbera balloon is that we will have about 3 days worth of fluid diet. So it is very similar to preparing for a colonoscopy, just without the diarrhea. So it's not as bad as that. So what we're doing is we're going on to a diet that prepares the stomach to accept the balloon. So in order to do that, what we need to do is flush out any of the excessive stomach acids and residues that might be in there. Because this is inserted via an endoscope, which goes down your throat, it means that we want to make sure the stomach is cleared of anything else that might be in there inside of the stomach wall, so that when we retract that endoscope, we're not risking bringing anything up into the lungs. So the pre-insertion diet is very, very important. The other part of that that serves to really help you is that what we're doing in that 3 days worth of fluids is we're decreasing some of the enzyme activity and we're decreasing some of that acidity, so that when the balloon is inserted, your stomach doesn't try as hard to digest it and break it down. So any of that cramping that you might feel around that balloon is because your stomach is designed to digest, and that is what it will try to do to the balloon. It's going to try to digest it within that first 24 to 48 hours. It will figure out pretty quickly that it can't do that, and that's when you'll start to feel more comfortable. But if you do stay on top of your medication that we discharge you with the balloon, that will be very manageable, and those side effects are very, very short term. Then comes the recovery process. So the recovery process of having the balloon inserted, we've actually now adapted that to be the exact same as what we would now see for the sleeve and for the band. And the reason being is that because the balloon sits up in the upper part of the stomach, it's sitting in the part of the stomach that doesn't have the strongest contraction force. When we digest food normally, food will fill up in the bottom of the stomach first. And it's actually this middle part of the stomach that will produce the strongest contractions. So what we need to teach the stomach how to do is for this top part to just give a little bit more force in digestion. And so we can't really go eating solid food straight away because that's going to cause a bit of cramping and a bit of nausea. So for the first 2 weeks, what we're looking at doing is being on a fluid-only diet. And for the first week or so, that's really all you're going to feel like anyway, because your body's got to get used to manipulating fluids around the balloon. So you'll fill up quite quickly in the first few weeks on fluids anyway, just because your stomach's got to get strong enough to manipulate that around the balloon. Then we progress up onto a semi-solid kind of a texture, like a puree. So we're giving your stomach a little bit more to work with. Then we'll move up onto a softer texture, and after that we move back up onto normal textured foods. And at that point, that's when we start looking at what we are going to be doing for that 6 months while the balloon is there in terms of your nutrition. Now, all of these procedures, the way that I'll look at balancing your nutrition is that we do get regular blood tests. So making sure that none of your nutrients are dropping too low and making sure that everything's staying within normal ranges. That's incredibly important. Now, what this device is designed to do is to start to get you used to having smaller portions and get your metabolism regulated. So it means that you're going to be having smaller portions of food, you're going to be having more consistent smaller portions of food, and your metabolism is going to adjust, and so is your appetite. So when that balloon is then removed at the 6 months, you'll feel like nothing has changed. And one of the most common questions I get is, when we take the balloon out, am I just going to be starving? And the answer is no, because of those hormonal and metabolic changes that do occur while the balloon is inside. And the other question I get is, does the balloon actually stretch out my stomach? And no, it doesn't. It doesn't do that at all. So at the 6 month point of this program, we also look at doing a metabolic test and an exercise test so that we can have an even better look at what your body is doing with your food, what your metabolism is doing, and what exercises are best suited towards improving that. So that's a really, really good and positive thing of this program, and I do really love the Orbera program for that reason. And so we continue to work together for that entire 12 months. So see it as a 12-month program. You might have the goal of losing 15 kilos or 20 kilos. Now, that doesn't mean that all has to happen within that initial 6 months while the balloon is in there, because we will work together for that entire year of getting you to your goal and maintaining your goal. All right. Did anybody have any questions about the Orbera from the audience tonight? No? Anyone online, please just type away and ask me, because I might actually move on to these two procedures now. So show of hands again, who's interested in the sleeve procedure tonight? Is anyone tossing up between band and sleeve? No? Okay. No, that's all right. Now, and anyone online, I guess that is one of the main things that we do see through the clinic is people who are very well aware of the band and who've done a bit of research on the sleeve. As Felicity said, it's been the newer procedure to come and maybe sort of take over as our gold standard in terms of what we have to offer as weight loss surgery. But it is something where a lot of people are a bit undecided as to which would be more suitable for them. And hopefully tonight, this can answer a lot of those questions. Now, the reason I'm going to group these two procedures together is because the preparation and the recovery for these procedures is identical, but there's just different, I guess, risks and things that I would be concerned about in terms of you following your post-surgery diet completely down to the T, as you all will. There's different things about both of these procedures that I would look at in terms of your recovery. So with these two procedures, they're laparoscopic procedures, as we've discussed, and the most important thing prior to this surgery is reducing your liver volume. Can anybody tell me why that would be important?
For access.
For access, yeah, perfect. So your liver actually sits just around the stomach area here. It's a very big organ, and it can accumulate a lot of fatty tissue around it. And it can do that very easily, even if somebody's 1 or 2 kilos overweight. The liver is a storage organ, and it tends to accumulate fatty tissue around it. And what we need to be able to do is reduce that fatty tissue. So we need to get the liver metabolizing that fat as energy. And that is very important. That is going to really significantly reduce any risk associated with this procedure, and it's going to make it a lot more straightforward and much easier for the surgeon. Now, has anybody who's been researching the gastric sleeve come across the preoperative diet?
Starvation for 3 weeks.
Starvation for 3 weeks. Don't know which internet pages you've been looking at. It's definitely not that bad. But is this news to anybody, the preoperative diet? No, it's definitely something we've come across. Okay. Now, the reason for that preoperative diet, like I've said, is purely to reduce what we call visceral fat, and we are specifically wanting to reduce that around the liver. So visceral fat is the type of fat that sits underneath the mesentery layers in your body and around your organs, and that's the fat that we are really concerned about. That's the dangerous fat. So we're not concerned about you losing weight as in terms of the fat underneath your skin. Most people will actually lose a fair bit of weight in that 2 weeks prior to the surgery, because it is what we call a medically restrictive diet, which means we are trying to get the liver to metabolize that fatty layer, which means that, yes, it is quite restrictive. It's not technically starvation, but yes, it is restrictive, and that is something that you will need to be prepared for. I like to tell people that really the pre-surgery and the recovery for a sleeve procedure or for a band procedure, you've really got to look at that time as being 2 months. 2 months of things changing quite quickly, and 2 months where, no, you're not going to be eating normally. So getting your head around, how that might feel for you for work, what kind of time you might need to take off of work. But we definitely have people who are able to go back to work after their 2 weeks, and they're fine. But it's just something to consider, that this is actually going to be something where in that 2 months, which includes the pre-surgery and post-surgery, you're really on top of where exactly you need to be and what you need to be prepared with. So the way in which we reduce liver volume is we use a VLCD meal replacement drink. Now, has anybody ever done shake diets in attempts to lose weight before? Yes, most people. How did you feel on those? Not fine, not too bad. Were they effective as a long-term weight loss method? No? Can anyone tell me why? Not really?
Too hungry.
Too hungry? Too boring? Too restrictive? Too unrealistic? Yeah. So you can already see, the reason that that these weight loss shakes actually started was purely for surgery. So they were created with a surgical purpose to be able to reduce fat around people's organs so that we could safely do a surgery. The weight loss industry has picked up these shakes to, I guess, promote weight loss and promote dieting. And the reason why most people just cannot stick to them long term is because they were never created for that purpose. So a lot of the time I get people who've tried the OptiFast or tried any number of VLCD diets, and I say to them, you need to do this for 2 weeks, and they say, no, you're crazy. That nearly killed me the first time. But the purpose of this is completely different. The focus is completely different. And so we do use a VLCD meal replacement shake, and there are also some approved foods that you are allowed to eat during that time. And the reason that we use the meal replacement shakes is because what we're wanting to do is give your liver a consistent amount of nutrition to process every day so that it can be programmed into metabolizing that fatty layer effectively. Now, if you're following that, that will happen in that 2-week period. It will definitely happen, but it will be something where it's just something to be aware of. The other thing about the shakes is that, again, what we're wanting to do is reduce the acidity and the enzyme activity inside your stomach, because that is also going to be beneficial for you during the healing process. So that's before your surgery. Now, after your surgery, as you can imagine, your stomach has got some healing to do, and that is with both of these procedures. With the gastric sleeve, you've got the main suture line that we really want to heal, and with the gastric band, there'll also be some external sutures just around that band to hold that in place while it's healing as well. So because we've got some suturing inside the stomach, we definitely want to keep the stomach absolutely still for that first 2 weeks. That's really, really important. Your body is going to be doing a lot of healing in that first 2 weeks, and we want to keep the stomach completely still. Now, for that, because of that, we will be on fluids only for that first 2 weeks. And the other thing about that is that even if you were to try to eat solid food, this part of the stomach here, you're still building up your enzymes and stomach acids again, and your stomach is not strong enough to contract and digest. So you don't really have any digestive capacity for that first 2 weeks. That is going to come, but we really have to take it right back and fluids only for that first 2 weeks, which is very important. Again, similar to the balloon, we build up through a puree, and then we move on to soft foods, and we will gauge that as you go. So like Natalie said, I'll be on the phone to you, or I'll be seeing you every week for the first 6 weeks, and that's because it's really important to me that we get this recovery right, because this is going to be what really sets you up for the first year post-sleeve, which is where we're really wanting to achieve some great results. And so if we do the recovery part right and we're able to get through that, then we're able to get on to the next phase, which is when we're looking at changing some of those lifestyle factors and changing some of the eating behaviors. We can't do that until we've physically recovered. So thinking about that 6-week period post-surgery as a time where your stomach is physically learning what it needs to do, and then after that comes the focus on, all right, so what do we need to change in our lifestyle? What do we need to change about the way we eat, where we buy our food, what kinds of foods should we be putting together to create some balance? All of that focus then comes after the 6-week period. So that's really what we're looking at for that initial phase of the sleeve. And then after that, you know, you will have unlimited access to all of us here in the clinic for that 12 months. And I generally tend to like to see people at least once a month, and that can be over Skype, that can be on the phone, that can be you coming in to see me. But I do really like to stay in touch, because sometimes all it takes is a past habit coming back, and then that can turn into 3 or 4 months of that. So we really like to keep in check and keep making sure that those changes that we're aiming to make are going to be permanent. Does anybody have any questions about these 2 procedures in terms of preparation and recovery? Not really?
Got one more
Yes.
about food.
Okay.
Is there any foods that will be kind of off the list forever, like, you know, meats or alcohols and stuff like that, that will be pretty much no go ever again?
So the question for those of you online was, after you've had a gastric sleeve procedure, is there any food or drink that is going to be off limits forever? And the answer is no. There's nothing that's going to be completely off limits. And again, what we aim to achieve with these procedures is stepping away from the diet mentality and really coming back into, I can have whatever I like in balance. In terms of physically struggling with some foods, the one thing that you'll probably find difficult for at least the first 3 months is that certain meats that are quite heavy, so something like a barbecued steak or really gristly meat will be difficult for you to digest, just because your enzymes will still be building up at that stage, and they won't be able to break that down as well. But what you would then look at doing is going, okay, well, I might cook that in a different way. I might make it like a slow cooked beef or a beef mince, and that's how you'd maybe go about making sure that you can still get that type of nutrition in. In regards to alcohol, You can definitely have alcohol again. Dr. Adib doesn't like for people to have alcohol in that first 3 months again because your stomach lining is not quite ready for that. But what we then look at doing is making sure that we're having alcohol in a safe way, because with alcohol doesn't actually get digested through your system. It gets absorbed out through your stomach lining. So you can imagine if you've got a stomach lining that's now very close together, it's going to hit your bloodstream a little bit more quickly than what it once would. So there are certain things that I get patients to practice at home before they practice in public, just so that we can make sure we know what's going to happen. And the other thing that that tends to be very difficult for patients to digest is anything that is really greasy, so like KFC, deep fried kinds of things. Because the amount of fat in that per mouthful, your stomach enzymes are just not equipped to deal with that much in the one go. So you will find that there will be individual things that you might struggle with. Some people find certain foods they could eat fine before the surgery take them a few months to be able to eat normally again. But there's no reason that you won't be able to digest and break down any foods that you were eating before the surgery, you will be able to have after. But certain things, like if you were lactose intolerant before the surgery, you're going to be lactose intolerant after the surgery. And everybody's quite individual with that, which is why I do work with you so closely in that first initial recovery after your surgery to gauge what you're having difficulties with and what's going down really easily. And then I know what we need to maybe work on. Yeah. All right. Is there anything else before I go away?
I just have one question. I just heard something about dumping, and I just wanted to explain what that was.
Okay, sure. Has anybody heard of dumping syndrome? Yes. Do you know what it is? Could you give an explanation?
No, I never quite understood it.
Never quite understood it? No, that's all good. Now, dumping syndrome is not something, it's not really actually something that I see very often with sleeved patients at all, because we still actually have the stomach enzymes there. I would probably more so see that after a gastric bypass. But basically what dumping syndrome is when we've gone a certain amount of time, maybe not eating solid foods or not maybe getting in so much nutrition, and then we go back to having maybe a bite of normal food or something that your body hasn't broken down in a very long time. What can tend to happen is that it just puts out our electrolytes and puts out our blood sugars. So you get a bit of a spike and then a drop in blood sugars. You might feel a bit fever and a bit sweaty and a bit ill and a bit faint. And then basically everything moves very quickly through the rest of your system. So that's basically dumping syndrome. Look, that can happen. That is not a surgery-related process that can happen in the body. That can happen if you've had the flu and you haven't really been eating much and you've been a bit run down, and then you have a few bites of toast and then, oh, there it goes. That can sometimes happen to pregnant ladies as well. So dumping syndrome is not surgery-related. It can be something that is just about your digestive system adapts to a certain way you've been eating, and then you have something outside of that and your body just has a bit of trouble adjusting. It's definitely not something that is ongoing. So if somebody experienced dumping syndrome, it wouldn't be that they would do it every day. It would be isolated episodes and one-offs. Yeah. And with the sleeve procedure, it would be really rare that I would actually see that. Yeah. Well, good. Yeah.
One of the reasons why we love the sleeve so much. You don't have to worry about it.
Thank you, everyone.
Thank you so much, Erin. Please make sure that you ask questions of Erin afterwards. She will still be here as well. Some of the things that we like to do together as a team here is get you involved in all sorts of other things beyond surgery. And today we've actually just started to plan our events for the year. Our first event of the year is actually going to be a cooking class. We love to sort of get you involved in learning all sorts of things about lifestyle activities that can change and enhance and improve the way you're living with your procedure. So life after surgery with us can mean all sorts of different things. We love to see you getting active and involved in sporting activities. That might be starting by getting you more mobile and walking. You'd be surprised at some of the events that people who've been through surgery have actually taken on board once they've achieved their weight loss goals. I've seen, we've done the Noosa Triathlon, for example, with teams in the past, all sorts of things. And just hard to imagine that those are things that you can actually achieve down the track. And we love to get involved with you in doing things like that. So yeah, the first thing we're going to be running is a cooking class with a very special guest chef. Those kind of things are really fun, and it's worth making the effort to come along and being part of that. If you're close enough and you can be here, definitely take that opportunity on board. It's part of your program, and we love having you around for things like that as well. How's everyone feeling so far? Doing well? All right. I'm going to introduce you to our last allied health team member before we move on to the very special guest patients to speak to you tonight. Please meet Warren. He's our psychologist who's been working here for quite a few years. Please make him welcome. Thank you.
Thanks. You've been here a long time. Well, I'll tell you a little story about this lady who visited the mental asylum. Let's start with that. And, she went to talk to the director to find out what the criteria was for somebody to be institutionalized in a mental asylum. And the director said, well, what we do is we normally fill up a bath full of water. We give them a teaspoon, a teacup, and a bucket. And we asked them to empty the bath. And the lady said, well, I see. So obviously a normal person would take the bucket because empty the water the quickest. And the director said, no, a normal person would just pull the plug. Would you like a room with a window or with a... All right, so anyway, there's no trick questions when you come and spend time with me. And I think that's one of the things that people are most anxious about. They don't really know why they actually need to come and see a psychologist. So I have been with this practice for about 9 years. And to date, I've probably seen somewhere around 3,000 patients go through either a balloon or a band or a sleeve or bypass. And the thing that I enjoy most about this sort of part of psychology is I learn a lot. I learn a lot of things that are very different, than your traditional general psychology. I'm dealing with people that are generally sort of in the same parallel almost as sportswomen, sportsmen, in the sense that they've got goals and they've got things that they're trying to achieve, they've got objectives, and they want to know how to get there. What's the best way for them to get there? And that's one of the things that makes this clinic quite unique, is that it is very much like a sports psychology environment, in the sense that you've got people around you here who can help you achieve those goals. So if you look at all the top sports players in the world, tennis players, golfers, they surround themselves with the right people. And that's what they need to get them over the line. That's what they need to not only get them to the top, but to keep them at the top. So there's a very familiar saying, and I come from a very strong sports background. It's one of the things that got me involved in psychology in the first place, is I wanted to become a sports psychologist, having had to retire from soccer very, very early in my career. And one of the very common things in psychology is, dealing with people with goals on an individual basis and on a team basis. And, people who are familiar with sporting engagements and those sort of goals will realize that it's actually much harder to stay at the top than it is to get to the top. And that's very, very similar to what you guys will go through. It's one thing to get the weight off. In fact, it'll be very, very easy for you to get the weight off. That's one of the things that's actually quite unique. And I was listening to some of the questions going out there early on. A lot of people are very interested in sleeve. Okay? It's a very, very popular procedure these days. And with something like the sleeve, the weight loss results are actually very, very good, but they're very quick as well. And I think we can sometimes forget, what are the things that we really wanted to see change in our behavior. We become very much obsessed with that outcome and that goal of just losing weight. And the thing that I like to try and work with everybody on is the processes. What are the behaviors that we want to see change? Because those are the things that are going to keep you out of trouble over a long period. Yeah. So, I was talking, I'm trying to sort of think of things that, happen with patients, because I've stood up here so many times, and sometimes I think conversation sometimes gets a little bit boring. So I'm always thinking of something interesting. But I did talk to a patient recently, and this perhaps might put something into perspective for you with these visits with the psychologist. That every time he comes to see me, there's always something new. He's always learning something new, not only about weight loss, but about himself. and questions are popping up all the time about how he's going to deal with things. So one of the things that we dealt with the other day, for example, was whether or not to tell people. He's in that situation. Do I go and tell people? Do I not? I haven't even told my parents. I mean, to be talking about a guy who's in his 40s. So he hasn't told his parents. He's not quite sure how they're going to take it because he's one of 4 children. And he's the golden child. And he's got some very overly traumatic parents who, so the world sort of gets turned upside down anytime one of the kids does something wrong, and he's the only one who tends to not give them any grief. So going to them and telling them now that he's going to have weight loss surgery would be the end of the world for them. So these are the things that sort of come up in the conversation. So what we'll do is we'll spend a bit of time prior to surgery, probably about an hour, talking about you, your background, family dynamics, your work-life balance, what you do for a living. I want to know what attitudes, I want to discover what sort of attitudes you have to healthy eating, exercise, what your relationships are like, people in your family, work colleagues, etc. Where your biggest stresses, where do they come from? And that way I have a very good idea about who you are. I build a case profile from that. That way when I see you after surgery, and of course we'll talk about certain things in that consultation because I want to give you some insight as to what this journey looks like. So to give you an example with somebody who does a gastric sleeve, we generally have two types of people. Those who do well and those who do very, very well. Okay. And so I want to give you some insight as to what are the key differences between those people. What are they actually doing to make not only their lives better and improve their quality of life, but to actually find that sort of happiness. Okay. Because weight loss surgery and losing weight on its own is not going to make you happy. Okay. Improving your quality of life and perhaps taking into an environment that has perhaps been missing for many, many years, or perhaps you've never had the chance to experience. That's what we're talking about. We're looking for those key elements that are going to help you actually find that happiness. It's not just going to come from weight loss. Okay. So part of that discussion before surgery is about us learning a little bit about each other and what I can do to help you, what you're like as a person, and then working with you at various stages. There are some generically scheduled visits. We want to make sure that you don't run away and we don't see you again. So we do schedule some generic visits to make sure that we are staying in touch with you and keeping you informed and keeping tabs on you and making sure that we're aware of any changes in your personal life. So to give you an example again, if you look at some of these top sports professionals in the world, I mean even somebody like Tiger Woods, fair enough, he's had lots of injuries, and there's a golfer who, at the peak of his career was very, very difficult to beat. But all that family drama and all that sort of social drama and pressure that he had on the side was really the catalyst for his downfall at the end of the day. So you can have all the talent in the world, you can have all the ability, you can surround yourself with all the people that you need. But at the end of the day, it will all come crashing down. And we want to be in a situation where at least in a position to help you when things don't go the way that you're expecting them to go. Okay. So any challenges that you might experience in your work, family life, anything like that, we want to be able to at least give you the opportunity to come in, address those problems, talk with the right people, and get back on track as quickly as possible. So for me personally, the first 12 months are paramount. We want to try and get as many changes in place as possible in these first 12 months. So I'll leave it there. I'll keep it short and sweet. Has anybody got any questions for me?
You keep talking about 12-month program.
Yeah.
Does it go past the 12 months?
Yeah. Felicity, do you want to answer that question at this stage?
Yeah,
I mean, we've always done it at up to 12 months, but I think...
yeah, sure. So the 12-month program is actually an all-inclusive program, and you have unlimited access to the support group during that period. So if you wanted to have an appointment once a week, you're encouraged to actually do so, or whether it's over the phone, however that looks for you, that's your opportunity. At the end of 12 months, sure, there's a little bit of flexibility if you want to keep going for a little bit longer. We're happy to see you here. And then there might be a little bit of additional cost if you wanted to keep coming to have appointments ongoing with both psychologist and dietitian. If you
Sometimes you fall off the rails.
100%, that can happen, and a back on track program can be designed for people who are in that kind of situation.
Sorry to interrupt.
Yeah.
Bear in mind as well that if you do find that you need more help after the 12 months, particularly if it's something that is becoming a little bit difficult to manage, then we can always send a letter back to your GP and you can request they put you on a care plan. Either an EPC, which is your enhanced primary care plan, which will allow you up to 5 visits in combination with the dietitian and the psychologist, or you could have all 5 with the dietitian, all 5 with the psychologist. And then, of course, just on the psychology side, you've got what is called an MHCP, which is a mental health care plan, and you can request that from your GP as well. That'll give you up to 6 visits in a calendar year. And based on my report back to the GP, we can request another 4. So you can get up to another 10 visits a year. So you have ample opportunities. You just need to keep us informed, and that way we can see what we can do to help you as well.
And if you're someone who identifies that you feel as though that could be a potential threat to you in the future, my recommendation will be use the first 12 months as effectively as you possibly can. They're there for you to use. And the more that you can absorb, learn and manage by taking on board the education that you get from the team in that first 12 months, you're going to set yourself up for to be in a good place, hopefully at the end of 12 months. It's hard for us. We're constantly telling people you have access. You can come here as often as you like, but it's the same old thing. You can lead a horse to water. But we know the value proposition and we know the impact of the results, and those who do commit to the total overall program are likely to get the best long-term outcomes. So I'd say start with the first 12 months, and then we can always look at if there are issues, what can we do to help you beyond that. Of course, our doors are always going to be open. All right. Thank you very much, Ryan. Okay, now we get to the really fun and exciting part of the evening, which is to introduce you to 2 awesome patient guests. In what order do we think we should go? Are we ladies first, gentlemen first? Do you want to toss a coin? I'll leave you to talk about it for a second. I want to grab my Jay's going first. All right. Okay. Fantastic.
All right. Okay.
Make sure you leave her plenty of time because I think she likes to talk a lot on.
That is so. Psychologists here hate me the whole time.
All right. A couple of things about Jay before he starts. So prior to surgery, was eating a lot of takeaway and mindlessly eating was a bit of an issue.
Oh yes, absolutely.
Yeah. That you'd had a bit of a worry about trying to maintain successful weight loss over a period of about 11 years.
Oh, I think probably more than that. I think I've been yo-yo dieting through every phase of Weight Watchers from 1986 onwards. I mean,
wow.
So, yeah.
I can tell you that Jay has provided Erin with endless entertainment and opportunity. His honesty in actually coming to her and telling her what he thinks is actually a relevant protein in his diet and reviewing and analysing things has just been so fascinating. But we'll let him tell you a little bit about it. And your BMI before surgery, so that for you to understand where Jay's come from, he started with a BMI of 40. He's now at 28.5 and has lost 44 kilos in 6 months. And the one question I asked Jay when he walked in tonight, is there any other way or any other opportunity that he would have found previously where he would have achieved that kind of weight loss in 6 months? What did you say?
I would have done it in 2 years. It's no way.
It's phenomenal. And that's indicative of what we see every day, and we love it. But please make him welcome. I'd love you to share his story tonight. Thank you so much.
Yeah, I don't know really where to start. I guess I was yo-yo dieting probably from the age of 14 onwards. I think I've done mainly Weight Watchers. I think everyone's got a go-to diet. They go to backwards and forwards. Weight Watchers is mine, but I've done F plan. I've done the 5-2. That's the one where you starve yourself for 5 days and eat like a pig for 2 days. The cookie diet, that was my favourite one, which was just eating cookies. That's around 10 which is fantastic. But none of them work. And every time, obviously, you get limited success. You probably lose maybe 5, even 10 kilos, and you feel really good about yourself, and then it all goes back on again. and then some more. So I got to the beginning of sort of 2015, and I was at the heaviest I've ever been. I shot up to 138 kilos. And my knees started to hurt, having difficulty walking, out of breath all the time, and being 41, that to me was just, that was no way to continue living, and that wasn't living, I was existing, to be quite honest. I wasn't happy with what I was seeing in the mirror, I wasn't happy with my quality of life, and certainly I needed to do something about that. The biggest thing for me was I was on a waiting list for nasal surgery. So with the public waiting list, it's quite long. And I had a phone call from a private hospital telling me that because of the waiting list in the public was so big, they could move me to a private hospital to get my nasal polyps removed. They then asked me my weight and my BMI, and they said I was too much of a risk for surgery, so they couldn't do it. And that to me was probably the scariest thing, that I couldn't have just simple surgery done because I was seen as such a high risk at the age of 40. So did a bit of research, and probably like most of you, internet, Facebook, YouTube videos, all kind of exciting stuff, and had a look around. And one of the things that became apparent to me with the different options out there was a lot of the weight loss surgery available, it was just the surgery. So for me, you saw people that were going and they were getting the best option. They were getting, you know, good surgeons, but that's all they were getting. There was no dietitian, there was no follow-up, there was no support network. And for me, if I was going to do this, I know through limited success before that the tool which I chose was the sleeve, that I needed additional help with that as well. So I chose here. I didn't actually come to one of these sessions. I phoned up, I couldn't get hold of Felicity, and then I came in and made the decision there and then to have this done. And it's just been a fantastic journey. Kelly helped me with the forms. I didn't need, I released my superannuation. That was the choice I made, knowing that if I waited another 12 months, it would probably be another 12 months and another 12 months until public health kicked in. And I kind of figured if I didn't use my super now, I was never going to get to use it by the time I was 65 anyway, when it came to retirement. So Kelly helped me with the forms. We released my superannuation, and the operation was great. I had all of these, you do all the research. Dumping was one that I saw, and everyone was talking about dumping, and you think, oh my God, this is it, and it's going to leak, and I'm going to be in all this pain. And honestly, I've had, touch wood, a dream run. I haven't found any food that I haven't been able to eat. I think water was probably the most difficult thing I struggled with, and you'll find that probably water is the last thing that you can actually drink lots of, but everything else has been fine. But right now I'm down to about 45 kilos. I can eat pretty much what I want. I still eat out. It's quite, at first you kind of feel a bit restrictive, and I think you probably go through the first 2 or 3 weeks where you think, what have I done? Oh my God, this is it, and then as you go through the liquid phase and the puree phase, which I absolutely hated, by the way, because I hate mushed up food, you get onto normal food, and then you start living again. And whilst there are those elements you think, well, I can't go out for dinner, once you start losing the weight, and the realization was I had to throw every single piece of clothing in my wardrobe away because I haven't been this size since I was about 13 or 14 years old. That's when you realize, so I can't go out and have a huge meal, or I can't go to a buffet, but you know what, I've got energy, I feel good. That's pretty much, I wake up now and I feel good about myself. So that's my story. Does anyone have any questions?
Did you have any hair loss?
No. Well, I've got that there, but I think that was prior, and the grey was already prior to the surgery as well, so I can't blame the surgery for that, but no hair loss. But I understand that obviously it can happen, but again, I think that also comes down to diet as well. So obviously you've got Erin and the guys that can help with that as well. I take vitamin tablets anyway. I was taking them prior to the surgery. I still take a daily vitamin now, and I think that's more of an age thing rather than, I was, have to get vitamins in somewhere. So yeah. Okay. Thanks.
Thank you.
Yes.
Short and sweet and wonderful. All right, hang on. I've got a couple of notes about you too. Let me see.
Hello. You guys are so quiet and polite. I'm just like sitting there like, this is me. I was yelling things out. What's this? That's great.
All right, please meet Kaz. Her starting weight was 41. And it's now-
BMI.
Sorry, starting BMI.
I don't really know my weight, guys.
And I've got my glasses on really. And it's now 27. And she's been amazingly committed from the start, I have to say. And I think this is really interesting. You went to America and you still managed to lose 4 kilos.
2 weeks, 4 kilos, America. And Americans, like, they know their food.
You're not human.
They know their food. But I was in New York, so subway stairs, man. Oh, they killed me.
One of the things that I love about Kaz is how she's embraced the whole lifestyle around what her sleep has offered her. She loves salads. I loved today's looking salad, looked amazing.
God, it's so good.
She's very creative and, embraces the whole lifestyle. Please make her welcome. I'm really looking forward to hearing her story.
I'll just say, I have this hashtag that I use all the time. Who knows what a hashtag is? Everyone knows what a hashtag is. Like, I think you kind of have to now because people use, like all these teenagers use it all the time. My favorite hashtag to use at the moment is maybe your salad's boring. Because I think there's heaps of people out there like, oh, I hate salad. I don't eat salad. It's because I think if you can find something that you love, it doesn't need to look boring. Just like find something you love. But anyway, so I guess something that really kind of triggered me to have the surgery is that my husband and I were trying to have kids. And just so you know, I thought I was fabulous before weight loss. I thought I was great. I was just like, man, I'm on it. I dress brilliantly. A little bit of background. I'm an identical triplet. So if you want to play the comparison game with people, nothing sets you up for comparison worse than being an identical triplet and your sister's being size 10. So I still thought I was great, but me and my husband tried to have kids for about 18 months and just couldn't have kids. And so I went to a doctor. They basically said, hey, look, you've got polycystic ovaries. That's a problem, but the fact that you're about 50 kilos overweight is detrimental. You need to lose that or you're just never going to have kids. And I said, you probably need to lose it in about the next 12 months. You're 32 now, you're 33 next year. You're really on a bit of a timer. So that's kind of was the cinch for me that I'm just like, okay, I'm just going to do this. I've yo-yo dieted as well since I was probably 12. And I grew up in that sort of, lower economic family where it's like you finish everything that's on your plate because there is nothing else. Very much high carb family, like because that's cheap and it's easiest to feed. So it's like, hey, you're going to have spaghetti a lot. So I guess like that's how I was trained. Like you eat what's on your plate, you eat big meals because you don't know, what your next meal is going to be. Probably since having she's really quiet and timid like me. It's great. But yeah, so that's probably something that I just struggle with. I just overate. So before surgery, I did eat good food. I'll be really honest with you. I was not I eat takeaway all the time type person. I ate great food. So I would go, I don't understand why I'm overweight. I had a salad for lunch. It's like, yeah, but I had a freaking bathtub of salad for lunch. Like it was massive. My portions were just ridiculous. So that's why I decided to have the surgery. A, to lose weight, to have kids. The side effects from it are like, now I understand that, I get to dress on trend. I don't have to wear something that hides everything. I had sleep apnea, didn't even realize it. I had the chafing in summer. Does anyone have that? Like the thighs, and you just end up walking the next couple of days kind of like this. Yeah, so like all that stuff that I thought I was great. But I didn't realize how far I'd kind of slipped. And I just go, like, the worst thing I think is that there is so much fat shaming and stuff that goes on in society. So even information sessions like this, you kind of come in and you're a bit like, oh. But like I just go, for me, now that I've had it done, there was nothing better I could have done. Someone could have told me it costs $1 million. I still would have got it done. Like the sleeve for me, it's just changed everything. And I know you're all probably looking at this and saying, okay, what's she got? I did it before and after for you. Because I think it's one thing to talk about it, but then when you see the difference. So there's 6 months between these photos. Look at my six pack. Oh my God, stop it. This is what it is to me. I thought I looked fabulous here. Guys, probably not so much. But I've got a great great husband who was like really supportive. He goes, I never saw you like that. What a sweetheart, but be honest with me, because like, wow. You know, like that's really sweet of him. But like I just go, I didn't realise to try and get pregnant on top of that, I had no idea. Like it just didn't click with me to go, oh, okay, that's why there's a struggle there, because there's already so much fat there. I'm so overweight. My body's trying to work with all this, plus trying to, you know, create a fertile environment. It was honestly the best. Here you go. Have a little look at that. You can see stretch marks and everything. It's fabulous. But yeah, like for me, I just go, that's something. It's. Do you know what? Isn't it the funnest photo? People just go, oh my god. For me, it was just like someone had recommended me take photos. It was these guys. They were like, take photos. I want to take photos. Best thing I ever did. Guys, if you just go through with it, take photos because it's so encouraging to you. And look, I could talk to you guys for hours and hours, but I've had the surgery. If there's questions you've got, just ask me. Like, so, I mean, does anyone have any questions? There were things I couldn't eat and I still can't eat. And everyone's different. Red meat I really struggle with. And that's just being honest with you. Slow cook, fine. But red meat, I pretty much steer clear of it. And my husband's South African, like the silver fox over here. So he's like his main meal is just like, let's have meat. I'm like, no. So do you know what I mean? Like there are certain things that I do struggle a little bit with. Pretty much I can eat, like Jade, pretty much anything. I did try and have a milkshake once, and I was violently, like, just nauseous for about 3 hours afterwards. And I think it is because of the sugar as well. Like, it's just such a lot of sugar for your body to try and break down really quickly. And you're just like, oh. Alcohol, I'm drunk in about 5 minutes. That's just being real honest with you. So if you're a big,
it's great.
Cheap date, man. Like, cheap date. My husband loves taking out for dinner now. He's like, let's go have dinner. Yeah, alcohol, if you're a big, like, let's have wine, booze, like, man, you're going to be drunk real quick. I didn't have alcohol for the first 3.5 months. I didn't have soft drink. I was, in terms of the pre-op diet, mate, if you want to buy the book person, that was me. Like, I cried a lot during the pre-op. I bawled. I got to day 3 and I'm like, I'm hungry. My husband's like, it's fine. But I stuck to I lost 8 kilos before the surgery, which they were pumped about. They're like, you're going to do great at this. After surgery, I stuck to it. I cried a bit after surgery. So, oh my God. And you do, like, because everything's so swollen, you have like 2 or 3 teaspoons and you're like, I'm full already. It's always going to be like this. Oh God. And you just, like, you do have a bit of virus. Your stomach's swollen, all right? They've just cut a major organ out. You'll be fine. Now I get through like half to 3/4 of an entree, depending on what it is. I can smash a salad. I'm really good at it because it breaks down to nothing. But yeah, is there any questions? Does anyone have questions? Because it's best to ask someone that's had it done.
Yeah.
Do I have scars? Yes. Did they heal keloid? Yes. I guess that's probably all I can tell you for now. I do feel good. Size 12 jeans, yo. That was the best feel. I've not been size 12 since I was in grade 6. Like grade 6. So yeah.
I have a question.
Sure.
Did you have anyone in your life who was particularly negative about this, or who wanted to, I guess, have negative opinions about the fact you've had the sleeve?
Yep.
What was your response?
Okay. I'm a little sassy. I'm not sure if you picked up on that. So I did have someone after surgery. I chose not to tell anyone before surgery. The only person that knew was my husband and my mum the day before surgery. I'm like, by the way, I'm having this done. And she was like, oh, okay, good decision. Yeah. I chose not to tell anyone before surgery because I didn't want, I think everyone's got a lot of opinions. And there's always someone out there that goes, I'll tell you how I lost 5 kilos. I'm like, I don't have 5 kilos to lose. I have 50 kilos to lose. Shush. So I didn't tell them before surgery. I was very open with people after I had it done. One particular person said to me, oh, so you cheated. And I went, okay, I didn't eat for virtually 2 months. That's not cheating. It is a tool. I ate well beforehand. This is controlling the portions that I can take. It's fixed my health. I don't have sleep apnea. And from my doctor's reports, my uterus is in really good shape now, and we'll be able to start trying to have kids again come May. So if that's cheating, then so be it. So that was probably the only negative feedback. That shut her up really quick. But I just go, like, if anyone tries to feed that rubbish to you and say you're cheating, like, it's not cheating. there are elements of this that are hard, but there are elements of this that just make things so much easier. For me, the hardest thing about weight loss is if I'm hungry, I find it really, really hard to do. I can't cope if I'm hungry. I work in a really, really stressful job in terms of like what I do for a living because I'm in sales and I'm key accounts. So I take care of like your top, you know, Yamaha, Honda, all those guys. It's if I'm stressed, I eat. If I'm feeling hungry, I can't diet. This is something that really fixed that for me because I'm just like, I feel satisfied, but I know that I've essentially cut my portions to a quarter of what they were. So yeah, I think if you're going to have people like that are going to speak negatively into your life, probably just need to get rid of them. But don't ever think that it's cheating. It's absolutely not. I mean, people could turn around and tell me now, you know, like I said, if it cost $1 million, I would do whatever I could to get it done again. Like, it's just the best thing I ever did. Any other questions?
In, say, like, what you consume food-wise now, say, like, mouthful-wise rather than, because every entree portion is different.
Totally, yeah, totally.
So, say, approximate mouthful-wise, how many mouthfuls would you find you probably eat before you fall?
So, for some reason, I find nighttime harder than mornings, which is actually a good thing because it's better that you eat less at night anyway. But night times I find harder to eat. So, typical day for me, I have a piece of sourdough toast in the morning, usually with cream cheese and tomato on it, because you can still, you don't have to turn into a rabbit. You can still eat food that you like. It just lowers your portions. Sourdough toast, I don't know if anyone knows about that big. I can get through that fine. No, not a problem. Lunch today, like I posted a photo. It was a salad. But like the salad bowls I eat out of are about this big and about this deep. I get through about half. So if it's got chicken in it, I get through about half. If there's no protein in it, I get through a lot more because essentially it breaks down to nothing. If you're talking like, you know, can you eat a sandwich? Totally, absolutely you can. But it's more like half a sandwich, not like a whole sandwich. You know, if we're talking in terms of like Subway or something like that, they don't make a 3-inch Subway. But it's about that. Like, and keep in mind, I'm 8 months post-op. Probably for the first 6 months, you know, I was getting through, you know, half to 3/4 of a piece of toast for the first 6 months. You know, I still go out for dinner. I go out for dinner all the time. Like, but we know that obviously facilitate. I don't order entrees. We go to places that are share menu. So generally people don't notice how much or how little I'm eating. Because I don't tell everyone, like, oh, I've had a gastric sleeve, #gastric sleeve. I just go, like, I've told people that we hang out with and our friends and stuff like that, but we generally go share menu because I can control what I'm eating. For me, I did look at both. I can't be trusted with the credit card because it gives me too much freedom. I can't be trusted with a band because it gives me just a little bit too much freedom. For me, I'm like, it has to be permanent. So that's why I chose the sleeve. I was just like, I don't want the options. I don't want to be able to make it bigger. I want it to be lifetime. That's it. That's all you can have. So that was probably why I went that choice. But hey, if you're good with credit cards and you're great with self-control in some areas, like I think that there's like, I know people that have done freaking fantastic on the band, like 45 kilos, amazing. But I guess it's what's best for your own personal situations. So yeah.
You mentioned you said that water or fluids was.
Oh my God! Like daggers, horrible. It's a nightmare. So
I miss being able to gulp. You know, like when it's really, really hot. You know, like, and I think that was probably the big thing for me.
Yeah,
you know.
Totally. I mean, I was drinking probably, and Jade was probably the same before surgery. I drink out of beakers all the time because I like to know how much water I've had. I was drinking liters before surgery a day, and like I could, you know, knock back skull 500 mils, not a problem. After the sleeve, the first 3 months, it was like knives. I'm talking like I would struggle to get about 500 mils in. So I switched to Gastrolite Icy Poles as well, just so I was getting enough fluid in. Unfiltered water, a lot easier, but you will never be able to go, oh my God, I'm so thirsty, glug, 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 because it fills the space up so quickly. Like, and especially tap water, man, it's so dense. Like we don't realize how much chemicals and stuff that they put in it until you've had that. Essentially, you're going to have the stomach of a baby. And if you've ever seen a baby try and glug water and they're kind of like, oh, it's kind of the same. So
it's very much the same.
Did you mix with juice? Did you mix with juice?
I had cordial, anything but pure water.
Yeah.
So is hydration something that you have to work, like you have to?
Yeah,
manage?
absolutely. Like, guys, let me tell you about constipation because I'm the expert. So, yeah, dehydration was a really big issue for me. I found that like the easiest things for me to eat, especially like in the first little while, I did have a lot of gastrolitis because I knew myself. I was dehydrated. It was hard. Mixing juice and water was good, and shot glasses, like just making sure that like I didn't, instead of filling up a normal glass, I changed to shot glasses and I would just fill it every half an hour so that I was always sipping something. Because I think if you have a drink bottle there, you think, oh, I'll get through that, but you just don't, because mentally you want to chuck it right back and just like glug straight through it, and it can't happen. It just doesn't happen with the sleeve. Now I'm okay. I can take a big gulp of something. I just can't keep glugging down. So, you know, and even when it comes to eating, you really do need to choose what you're going to fill your space with. So something that people probably don't talk about a lot is like, you can't really, especially in the first 6 months, you're not going to be able to go out for dinner, order a drink and order your food. You get to choose what you fill the space with. So if you're going to have a drink, have it like 40 minutes before your meal, because you won't fit both in at once. And again, the fluid makes everything expand. So I know now why babies just writhe in pain when they get wind and when like stuff's too full, because yeah, basically you'll have a few issues like that while you get used to it. I freaking love it now. I get girls ringing me all the time that have just had it done or are thinking about getting it done. And I reckon I'm like the best salesperson for gastric sleeve, because I'm like, oh, get it done. It's the best thing you'll ever do.
We should just send you out on the streets for us.
I know, it's rude. Yeah. But yeah, like it comes with its challenges like anything. If you think it's going to be a quick fix solution, if you eat takeaway every single night and you just eat crap all the time, sure, you can get the sleeve and you might lose a little bit of weight, but it won't fix what's inside your head and the way it's been wired. Like, you have to commit to actually changing it. And probably the best thing about this clinic, and I'll be really honest with you, I ran 5 clinics before I ran this clinic because I live in Brisbane. So this isn't convenient for me to go all the way to the Gold Coast. But of all the clinics that I spoke to, these guys were the best in terms of their follow-up, in terms of the information that they gave. And they're not like, sign here first and pay up front and then we'll give you some information. They will like give you as much information as you need to make you as confident as possible. Dr. Dib, massive straight shooter. He was like, yeah, you are overweight. I was like, thank you. But like, man, he is a great surgeon. I remember like the very first, like when I went for my day of surgery, I was freaking out. I've never had I've not even been in to have like, you know, an ingrown toenail removed. Like, I don't do hospitals.
It's more painful.
Is it really?
Yeah.
Like, so I was pretty nervous to the point that I was outside the room and I just like really welled up with tears. I'm like, oh my God, stop being an idiot, stop being an idiot. And then when you tell yourself that, you cry for more because you're girls. Yeah, good times. I had an orderly come up to me. He's like, oh, are you having surgery today? And I went, yeah. And he just goes, who's your surgeon? I said, Dr. Dib. He goes, oh my God, Dr. Dib's the best surgeon in this hospital. Completely put my mind at ease. You know, even when they were talking about Dr. Dib's statistics, he even came and said that to me. He goes, I need to let you know about the statistics. They're not my statistics, but they're the statistics. He is a freaking fantastic surgeon. He's just, if there's an expert at what he does, it's him. Like, I felt safe with him the whole time. Like, follow up everything. Like, he really knows his stuff. He's a straight shooter. So if you want someone to reassure you, talk to Warren. But he's great. Like, he's fantastic. Is there any more questions? I'll be really honest with you.
Do you feel thirsty, like in the beginning? Because I glug water a lot. Like, do you feel really thirsty in the beginning? Do you feel like you're just like parched in a desert or something?
Oh my God, let me tell you about when I came out of anaesthetic. I came out at like, yes, short answer, yes. I came out of anaesthetic as well on the day, and I had a little bit of a reaction to the anaesthetic, and I was on fire. I was like, I just need some water. Like, you had stomach surgery, you may have nothing. I'm like, oh God. They gave me face washes to suck on. All I wanted was a glass of water. The Castrolite ice pods, man, they were the best. Like, they were just the best because they really did quench my thirst. They put the electrolytes back. I'm a glugger as well. I'm like, I just want cold water. I want a big glass of it and I want it full of ice. So for me, that was something that was hard, but you get used to it and you work out ways to kind of do it.
The ice chips were really good after surgery.
Yeah.
Just
Sucking on ice, amazing. They won't give it to you directly after surgery. Coming out anesthetic, if you get hot flushes, bad luck, you may have nothing. Yeah, so that's like, yeah, I'm a glugger. I will let you know this, guys. You have this surgery, your power bill's going to go down. Not in winter, because you'll be colder because you don't have as much polar bear insulation. But I constantly, my air conditioner in my house before surgery, it's on 7:10. It goes on at 6 in the morning. I'm from Victoria originally. It's hot up here. Like, I was like, it's got to be on constantly. Now it's on 22. It's on maybe 4 hours a day, if that. Like, I couldn't believe the difference. And even now, I'm like, I'm freezing. I'm cold in here now. I'm like, turn the aircon off. It's freezing. It's, yeah, like, it's just changed everything. And no chafing anymore, guys. Nothing. No Curash, no Bepanthen, nothing. Great. And for the girls, no, I did not lose my boobs. That's all you should know. Yeah. Skin sag, like skin sag, that happens. It's gonna happen. My thighs look like they're frowning a little bit now. They're like, but it's fine. Like, I just go. I think the positives far outweigh the negatives.
Well,
everything else is kind of stretched back.
one negative is you can actually get pain when you sit down because you've got less padding here.
Oh yeah, totally.
It's like, oh my god.
I sit on my husband's lap now. I'm like, oh my god, you're so bony. He's like, no, that's you. I'm like, oh.
Yeah, and you sort of get things you're like, oh my god, what's that like? Oh, it's a rib.
I was like selfies. I was like, look at this. I'm like a Victoria's Secret model. Look at this. Because you just go, guys, I've not been this size since I was in like year 7. Like year 7. Even that's big for a year 7 still. Like, you're not going to be like a model overnight, but my God, you feel so much better. Like, no one wins Throwback Thursday like I win Throwback Thursday now. Like, post, check this out, 40 kilos difference, good times. Like, it's just, yeah, it's the greatest thing I've ever done. Besides getting married to my husband, just in case he's watching online. Greatest thing I've ever done, guys. Honestly, like, I cannot tell you. Like, there are some negatives. The pre-op diet, post-op diet. Am I allowed to curse?
You're allowed to.
Oh, shit house, guys. It's horrible.
But it's not my fault.
It's not Erin's fault. She's great. It's like, it's really hard. Like, if you've ever done protein shakes, it's really hard. Essentially, you're not going to eat for a month, guys, but so worth it.
But it's the last diet you'll ever do.
Totally.
That's
I eat whatever I want now. Not whatever I want, but you know what I mean, within reason. Because I can still try absolutely everything. It's just that now there's a much more restricted approach to it. So, okay, is that it? Yeah. I talk a lot. I'm really sorry.
It's amazing. No, thank you so much.
I'm not meant to say this. I'm not allowed to have a favourite child or a favourite patient, but these two, I think, have to absolutely be two of the most inspiring and wonderful patients we've ever had the opportunity to work with, and just so appreciate having both of them here to share their wonderful stories. And I love the look of all your salads. In fact, maybe you could do a guest salad at our next cooking
guys,
class.
I nail salads. Mine totally.
They look so amazing.
You know how some of them are like, I made you a salad. It's iceberg lettuce and tomato and some vinaigrette I just bought.
You're just writing all information.
Yeah.
My lunch today.
Yeah, British over there doesn't mind. He's just like, that's tasty. No, it's not. You don't know.
So will you come and do a salad
Oh,
at
of
our cooking
course.
class?
Love
Yeah.
to. Love
All right.
to.
Thank you both so much. It was wonderful having you here. Thank all of you so much for being here and coming along to listen to us. We really appreciate having you here. All of our team will be here to answer your individual questions. If you've got something you'd like to ask or you want to talk to Jay or Kaz, I'm sure they're happy to have a chat. If you're ready to say, this is my time, I'm ready to make an appointment, we're happy to help you. Erin and Kelly can help you with that right away. We're more than happy, and our doors are open to assist you with whatever you need. And thank you so much to all of our online viewers tonight. I think actually Erin mentioned that Eric's on his way. He's driving down here next Monday, so we really look forward to meeting you. And thank you to the others who joined us tonight. Many thanks. Thank you all.
I knew the photos were
We have to have a photo taken.
Yeah, we totally do. Just gonna do a